How do pediatric ophthalmologists detect uveitis in kids? Imagine trying to find tiny signs of trouble inside a child's. Pediatric ophthalmologists have special ways to spot uveitis, an inflammation inside the eye that can sometimes hide without obvious symptoms. Detecting uveitis early is very important because, if it is left untreated, it can cause serious problems like vision loss. Children with conditions like juvenile arthritis are at higher risk, so careful screening is essential. The process begins with asking about the child's health and any symptoms. Doctors will inquire if the child has redness, eye pain, sensitivity to light, blurred vision, or if there are known conditions like juvenile arthritis. Since young children might not be able to tell us exactly what they feel, parents and caregivers play a vital role in sharing observations. Next comes a detailed eye exam. The doctor will check how well the child sees using age-appropriate vision tests. A key part of the exam is a slit lamp examination, which uses a special microscope with a bright light. This allows the doctor to look closely at the front parts of the eye and see signs of inflammation. They look for cells or protein in the eye fluid, deposits on the cornea called chorotic precipitates, or adhesions between the iris and lens known as posterior synecdoche. They also check for cloudiness in the lens, called cataracts, or inflammation in the gel at the back of the eye called the vitreous. Measuring the pressure inside the eye is also important because uveitis can sometimes affect it. Sometimes, uveitis can be silent, especially in children with juvenile arthritis, meaning there are no obvious symptoms. That is why regular screening is crucial for children at risk. The doctor will schedule exams based on the child's age and health history to catch any inflammation early, even if the child is not showing signs. In some cases, additional imaging tests help get a clearer picture. Optical coherence tomography, or OCTOBR, is a painless scan that creates detailed images of the retina and is well tolerated by children. Fluorescein angiography and indocyanine green angiography involve injecting a dye into the bloodstream to highlight blood vessels in the eye, helping identify areas of inflammation or damage. These tests are used when more detailed information is needed, but are not routine for every child. If infection or systemic disease might be causing the uveitis, the doctor may order blood tests, urine tests, or X-rays. The specific tests depend on the child's symptoms and medical history. For very young children or those who cannot stay still, the doctor might recommend an examination under anesthesia. This allows a thorough and safe assessment when a regular exam isn't possible. Throughout this process, the eye specialist documents their findings carefully using standardized grading systems, such as the SUN criteria, which help track how much inflammation is present over time. This information guides treatment decisions and helps monitor progress. In summary, pediatric ophthalmologists detect uveitis by combining a detailed health history, careful eye exams with special tools like a slit lamp, regular screening for children at risk, and sometimes imaging or lab tests. Early detection can prevent serious complications and preserve vision. Working closely with families, pediatricians, and eye specialists ensures children receive the best care. Always remember to consult healthcare professionals for personalized advice and treatment options tailored to each child's needs.